Complications of otitis media. Acute otitis media is the inflammation or infection of the middle ear and mastoid air cell system. Otitis media is a potentially severe disease due to the risk of complication. Middle ear infections typically result from a eustachian tube dysfunction coupled with upper respiratory tract infections or allergy. The eustachian tube opens with palate movement and continually equalizes pressure in the middle ear. Inadequate opening leads to abnormal pressure in the middle ear. Negative middle ear pressure builds up, allowing fluid to be pulled from the middle ear mucosa. Stagnant fluid accumulation behind the eardrum allows for bacterial and/or viral growth within the middle ear, leading to acute otitis media. Once in the tympanomastoid compartment, bacteria can take different pathways and spread to various adjacent structures. Based on the location of the affected structures, complications can be divided into intratemporal and extratemporal complications. The latter can be divided into intracranial and extracranial complications. Intratemporal complications of otitis media include mastoiditis, labyrinthitis, facial nerve paralysis, eardrum perforation, tympanosclerosis, chronic suppurative otitis media with or without cholesteatoma formation, ossicular erosion, and petrous apicitis. Mastoiditis is the most common complication stemming from otitis media. Pus develops in the mastoid air cells, and as it increases in volume it affects the bony walls of the mastoid air cells, which may lead to the dissolution of surrounding bone. The infection may then spread to adjacent structures. Labyrinthitis occurs when bacteria spread into the fluid-filled space of the semicircular canals via access points such as congenital labyrinthine deformities, the round and oval window, and temporal bone fissure, fractures or tracts. It can also result from the direct extension of pus into the inner ear. If the bone erodes over the lateral semicircular canal, a labyrinthine fistula can occur. Facial nerve paralysis can result when the infection from the middle ear affects the nerve itself via the fallopian canal, or if the infection erodes the bone overlying the facial nerve, allowing it to become inflamed or compressed by purulent fluid. The facial nerve may be congenitally dehiscent in the middle ear as well. Tympanic membrane perforation happens when purulent fluid stretches the eardrum, causing ischemia and necrosis in the pars tensa. These are usually small. In the acute setting, these usually heal. Chronic perforations are a sign of chronic otitis media. Tympanosclerosis occurs when inflammation of the middle layer of the tympanic membrane results in a white calcific deposit. This looks like a bright white spot on the eardrum. A cholesteatoma is a pseudocyst of skin cells and debris in the middle ear and/or mastoid. Pockets of keratinizing squamous epithelium from a chronically retracted tympanic membrane can invaginate between the ossicles. These pockets fill with keratinous debris, which contains inflammatory mediators that allow bone resorption, resulting in damage to the middle ear structures. Ossicular erosion occurs when the infection spreads, causing destruction to the middle ear ossicles. This can occur in chronic infection or with a cholesteatoma. In petrous apicitis, infection spreads to the petrous apex of the temporal bone, damaging the air cells found there. Extratemporal complications of otitis media can be subdivided into those that affect the central nervous system and those that involve the temporal bone and extracranial structures. Extratemporal central nervous system complications are lateral sinus thrombosis, meningitis with or without encephalitis, encephalocele, increased intracranial pressure, abscess formation, cerebrospinal fluid autouria, and cranial nerve issues, except 7th cranial nerve, which is intratemporal. Lateral sinus thrombosis may occur when infection from the mastoid penetrates the venous wall, forming a thrombus in the sigmoid and lateral venous sinus. Otitic meningitis is the most common intracranial complication of otitis media and is caused by infection extending to the meninges surrounding the brain. An encephalocele may occur when middle ear infection affects occipital or frontal bone, allowing for brain tissue to herniate through. Increased intracranial pressure and suppurative otitis media can result in otitic hydrocephalus. The pathogenesis involves abnormal cerebrospinal fluid metabolism secondary to inflamed meninges following chronic otitis media. Abscess formation. Epidural and subdural abscesses can occur when the tegmen is eroded with contiguous spread of infection. These can spread into the brain, typically affecting the temporal lobe or cerebellum. Cerebrospinal fluid autouria. If the tegmen erodes, then the brain has access to the ear cavity. If the dura also opens, CSF can leak into the ear canal, which can lead to cerebrospinal fluid effusion, hearing loss and CSF drainage from the ear. Cranial nerve damage. The Gradenigo syndrome is a triad of otitis media, severe pain in the trigeminal nerve distribution, and ipsilateral sixth cranial nerve palsy. This occurs when inflammation from the middle ear spreads to the petrous apex and tissues close to the cranial nerves. Extratemporal extracranial complications include subperiosteal abscess, Bezold abscess, Satelli abscess, Luke abscess, and parapharyngeal or retropharyngeal abscess. A subperiosteal abscess is a collection of pus between the periosteum and the lateral mastoid wall. This results in a red swollen area behind the ear. There may be an outstanding ear. A Bezold abscess occurs when pus erosion through the mastoid tip allows infection to spread to soft tissues of the neck. It tracks beneath the sternocleidomastoid muscle. A Satelli abscess occurs when pus from the mastoid process tracks posteriorly and collects in the occipital region. A Luke abscess occurs when pus tracks from the middle ear along the external auditory canal to reach the temporal region. It's an abscess under the temporal muscle. A parapharyngeal abscess occurs when pus from the mastoid process tracks medially into the parapharyngeal space. This can spread to involve the retropharyngeal space. Complications from otitis media are rare but can have devastating consequences.